Hi, Dr. Peter Montgomery, family practice doctor, here to give another COVID update on April 5th. It's Sunday, Palm Sunday, and I'd like to give an update on how things are going. We're entering probably our toughest week to 2 weeks coming up here. The numbers are going to get worse. The lockdown, self-quarantining is going to be a bit more stressful. Watching the news is going to feel like too much, and I recommend you try not to watch too much of the news and try and be healthy. I want to focus today more on prevention and treatment again, and what we can do during this time. Peak number of cases are upon us, and soon in your area, New York City is hitting peak cases, and the rest of the country over the next 2 weeks will be increasing peak cases, peak people in the hospital, followed by a week or so with peak people dying. Um, and so we're doing what I can right now, everything we can, washing, waving, wiping, and whoa, not touching our face to try and not spread the virus as much. We're doing social distancing and self-quarantining, trying not to go to the store too often, doing things that are difficult for the economy for us not to be out, but we have to deal with this now. Um, People having difficulty with the economy. Uh, it's not really my forum here, but my heart goes out to you, and let's see how quickly we can get through this so we can have an economy to come back to. So today's talk is going to be mainly again about the prevention and treatment. First, we're going to give a little update to see where we are right now, and then we'll get to the prevention and treatment talk. Thanks. I like to start with the overview of the U.S. weather map, our temperature weather map. Again, with it still the worst part is New York City, where they're at a peak. Also, Florida, especially Miami-Dade, has been, very hot. They had a very high spike and crash. They are getting their temperatures down below flu season average. New York City, zooming in there, they had a very high peak. Here's Manhattan's numbers there. Very high, long peak, continuing out, but seems to be coming down. Louisiana and New Orleans has had it the worst. The suspicion is Mardi Gras infected a lot of people, came in, infected a lot of people who lived there, and everybody got out and spread it a lot, leading to the highest death rate in the U.S. Per capita. But they're doing the social isolating, and they are well below national average. And going up to Michigan here and Detroit, obviously a very good job of social isolating. Chicago, which is Cook County, also doing a very good job. I'm here in the St. Louis area, and we're getting it down. Talk to my friends who are in the hospitals here and work in the ICUs. We are not overwhelmed. We have capacity. Everybody's working their best. We are waiting for the wave, though, to come, and we're making efforts to have well clinics for people who are not running a fever, not having respiratory symptoms, and fever or sick clinics for people who are to physically separate them, so we can keep taking care of everybody who has medical needs and getting the people quickly tested for COVID or influenza or other respiratory febrile diseases and get them treated as quickly as possible to keep them out of the hospital. Again, LA, San Diego, all doing a very good job of keeping it cold. I guess that there's a point to how low you can get your fevers. I think they're doing a very good job there. San Francisco and everybody else doing well. And up in Seattle, kind of complete. They had dropped. It's kind of bounced up a little bit for one day, but it's kind of the weekend, so let's see how we can do it, getting things brought back down. Testing, we're still testing well over 100,000 a day. And at a whole almost 1.7 million tests. We need to be doing more faster, but things are heading in the right direction. Worldwide, here's the worldwide numbers. 1.2 million confirmed cases. We know that the number's probably 10 times that of people who had mild disease, didn't know they were infected, moved it on, or countries just underreporting. Total deaths, again, more accurate number, again, probably still underreported. People who die for other reasons, not everybody's getting tested, but this number is a lot more accurate. And the world is actually had a drop today. I don't know if it's statistical lowering because it's Sunday. We'll see if that's actually a trend or not. Looking at the countries that have been having the worst time, Italy has turned the corner, peak cases over a week ago. And today, because of the lag from peak cases to actually people being in the hospital, people dying, they actually had peak death. They actually had a decrease in the number of people dying. Spain has also had the same peak and drop off and actually having decrease in people dying. Very good. The U.S. is still rising. Again, Sunday, not sure if that's just a low number for Saturday or Sunday. We'll see if that trend continues or not, but don't think we're at our peak cases yet. Germany doing a very good job in Europe, and they're getting their numbers down. France, odd number spike there, screwing up the numbers, so it's hard to tell what's happening. United Kingdom still going up there. Boris Johnson, their prime minister, is actually in the hospital now, getting extra testing. They did not say he was on a ventilator or anything, but my hopes and prayers goes out to him. And Switzerland, they've had peak. They're coming down. Belgium, the Netherlands are right next to France, doing turning the corner there. Sweden, where they're not doing any social isolating intentionally, had a peak. Look, it's come down. They got 3 numbers that are lower than their peak, but they peaked later. Norway, right next door over the mountain range, it peaked quite a while ago. Also right next to them is Finland, and I do have to look a long way down. Finland, also next to Sweden, seemed to have a peak and then had a weird high number, but still they're doing very good there. So that's kind of the national numbers, international numbers. And Russia has been having some peak cases here. Their numbers were really low for a long time and steadily been going up. I'm not sure if that's still rising or not. Not good enough to tell the trend there. On the Worldometer website, and here is the world numbers. Deaths per population, about 9 per million. The USA is at 29. We're at the top of that because we have the most cases in the world in one country. Spain, 270. Italy, 263. Belgium, France, Netherlands, kind of another section. Their numbers are about half of Spain and Italy, but still very bad. Switzerland, Luxembourg, Sweden, Denmark, and is kind of another group. The USA on their level. Germany is doing better at 19. Going out a little bit further, Western Europe, Poland. I skipped their numbers. I was looking for it. Poland's way down here, doing even better than Germany. And Russia even lower. So it seems as the further east you go in Europe, the lower the numbers are. Finland doing very well. Of the Scandinavian countries, doing the best there. So I hate to focus on such a negative term, but that's pretty much the one hard test number to go by. Testing is, been sketchy worldwide, but deaths are pretty hardcore. So what can we do to avoid that? What can we do as far as preventing and treating? Prevention, again, not getting in the first place. Washing, waving, wiping, and whoa, don't touch your face. Do what you can to do that. Social distancing, self-quarantining, wearing a mask. If you have the disease and you're around other people, please wear a mask to not spread it. It's prudent if you're going out to a public area to wear a mask, and even better, even some sort of eye protection if you can. For the doctor, things you can do to help keep yourself healthy: vitamin D, zinc, and even vitamin C, and even echinacea have been proven to keep regular upper respiratory viruses down. And also pretty much your pre-infectious zinc and vitamin D levels have been tested. People have better outcomes. So taking them ahead of time now decrease your risk of getting it. If you do get it, more likely to have a better outcome. Doctors are faced with a difficult situation giving antivirals without a lot of really good data or clarification on it. So there is a way we measure the quality of data, A, B, or C. And the best we could achieve here is expert opinion or descriptive studies, and we do have that to guide our treatments. The Chinese have been treating this the longest, and they have printed out a very detailed handbook on what to do and medications, and they recommend starting as soon as you're suspicious that it's COVID to start antiviral medications. Hesitating to start medications that have been proven to be helpful would not be wise and not your patient's best effort. And going back to here on the treatment side, hydroxychloroquine, zithromycin in a small study has shown that people did very well. And when you look at the study, this is why they recommend the hydroxychloroquine compared here. It's the blue line and hydroxychloroquine Zithromax. And people who did not get any of the treatment, the people in the Zithromax hydrochloroquine combo got to no detectable virus within 5 days. And it is a 5-day treatment. So excellent. Hydroxychloroquine alone, very good. So expert opinion. They've treated only 80 patients, but this is their numbers. They did have one patient die who was in the 80s, which sadly is statistically in the norm. But the question is, how many people can they get to not being in the hospital? Treating people before they have large amounts of mucus in their lungs, needing oxygen, being on ventilators. So as far as expert opinion, that's the best we got. I've called all the pharmacies around in our area, and they are stocked with both Zithromax and hydroxychloroquine, and they have been filling it for my patients, and my patients have been doing well. We're still having 10 days to get results. That is speeding up, but I'm not waiting 10 days to start treatment. The ethical advice from experts treating, in the study I was reading, it was people treating MERS, so it is most ethical to start medication as soon as you realize you have some expert opinion and a reasonable study. The hydrochloroquine and the chloroquine works by getting zinc into the cells. The zinc is doing the job. It is gumming up the enzyme that allows the virus to replicate. Viruses aren't alive. You can't kill them, but you can make them not reproduce very quickly. And the zinc helps with that. Zithromax, the Z-Pak, the medicine there is what we call bacteriostatic. It doesn't kill cells either. It doesn't kill bacterial cells. It slows down their reproduction by slowing down the mechanism of reproduction. Again, that same method could help with slowing down viral reproduction. And that combination, I like to say kicking and punching, or if I'm going to race somebody, and he's faster than me, and we're in a foot race, I want to have him wearing ankle weights and a backpack. I want to stack all the advantages I can in my favor. So that's why taking the zinc helps protect against colds, because it's getting into the cells and gumming up the viral reproduction mechanisms. It's also why the medicine is dangerous, because other salts in our body similar to zinc is magnesium and potassium and calcium, and they are things necessary to make your heart beat in a nice, regular, even rhythm. And if the zinc is getting into the cells, so leaving the bloodstream, so is the potassium, so is the magnesium. And so there was concern that these medicines in combination can cause heart irregularities. So it is prudent upon the doctor prescribing it to make sure they're not on any other medicines that would do it, to advise the patient to take their zinc. While they're taking the zinc, there's over-the-counter potassium tablets and their prescription potassium tablets. There's over-the-counter magnesium pills and prescription magnesium pills. Again, that would be something to prevent a side effect. Again, the medicine's only going to be for 5 days, and be out of the system very quickly. So I think probably wouldn't be a bad idea to take a little supplement while you're the first day of the medication. Make sure your levels aren't low, and make sure you're not on other medicines that would interfere with your lowering your potassium. If you're also on a water pill, Lasix or hydrochlorothiazide, you might be low in potassium. So just kind of notes to the doctors out there who might be listening, thoughts that I have about the medications and treatment. But the main thing is if someone's getting shortness of breath, chest pain, extreme fatigue. Fatigue is, for me, just another marker for shortness of breath. They need to be in the hospital. They need chest x-rays, they need lab tests, they need intensive care or at least pulmonary expertise on the case. So that's my advice on preventing and treating the hydroxychloroquine. If you have family members who are sick, we have treatment options. We have some expert opinion to go on. More advanced techniques and treatments are coming along the way. They have figured out antibodies from some people who have already survived the infection. Their antibodies could be concentrated and injected in people who are terribly ill and not doing well on ventilators. There are some cases of that already being done in people who have not improved on the hydroxychloroquine, Zithromax, and other treatments, getting that advanced treatment and that working. They can actually mass produce that. We have been doing antibody treatment for over a decade now, possibly 20 years, giving antibody treatment, specific commercial lab-made antibodies produced. And so that's been in the news lately. Still experimental, but not unheard of. And of course, the vaccine's coming. Again, that will take a full year. And who needs to have the vaccine? They're having a test to actually prove if you've already been infected. I think there'll be long lines for that test. People want to know, have I had the infection already? And if you've had it, you can return to work knowing that you've had it and you're not going to get it and you're not going to spread it. Once you've had the infection, I would definitely say for about another 2 weeks, 14 days, you should continue to self-quarantine. Minimum, I would say 14 days, to keep from spreading it to other people. So these guidelines will be worked on by the experts and passed down, and I appreciate everything they're doing. But just again, from our St. Charles County, a nice, easy to follow advice here. Vulnerable populations to watch out for. People are low risk, what you should do, but basically high risk. If you've had a test, close contact, self-quarantine, and seek medical care if your health condition starts to deteriorate. So again, that's my update for today, and thank you for listening, and I'll be back again tomorrow. Thanks. Bye-bye.